3.
The title of my speech is Breast Cancer. The purpose of the speech is to tell you about the ways to detect breast cancer, the types of cancer, and the ways to treat cancer. The specific purpose of the speech is ways to find out if you have breast cancer and ways to cure breast cancer. The central idea is to learn how to find out if you have breast cancer and what happens after you have it. Do you know someone that has had breast cancer? Did you see how hard it was for them to get through it and to after they had? Well, I have, and it's very hard to watch someone that you love go through with it and with all their treatments and everything. The idea that I'm mainly going to talk about is how you can find out if you have it and what happens after that. The reason I decided to talk about this topic is because of the people that have fought this cancer and the people that will fight breast cancer. This topic is relevant to you because most of you have known someone that has gone through breast cancer, or you know someone that will go through breast cancer. The first point that I'm going to talk about is ways to detect breast cancer. Some ways to detect breast cancer are at-home self-examinations and medical examinations. Some ways for at-home self-examinations are an at-home self-exam. They are recommended from doctors to be monthly and to be done while you're in the shower. You are to perform these at one at a time with one arm raised and feel in a circular motion. There are also ways to detect breast cancer while you're at the doctor's. Some ways to detect breast cancer medically are by mammograms, biopsies, CT scans, and ultrasounds. Your gynecologist will also perform routine breast examinations during a yearly checkup. If you know that your family has a history of breast cancer, I would suggest getting checked out more often. That are some ways to detect breast cancer. Now I want to talk about some of the symptoms that breast cancer has on you. There are all different types of breast cancer, which can range from visible symptoms to non-visible symptoms. Some examples of visible symptoms of breast cancer are redness, lumps, swelling, discharge, and ridges. These are the most common types of visible symptoms in breast cancer. Some examples of non-visible symptoms of breast cancer are sharp pain, fever, tenderness. Now, while those are the most common symptoms of breast cancer, there are many different ways to still show signs of breast cancer. I got that from the Breast Awareness and Screening site. As you can tell, there are many different kinds of symptoms, and some are visible, while other symptoms are also non-visible. Now I'm going to talk about the different types of treatments and how these treatments can affect your body. There are many different types of treatments, and what kind of treatments you have depends on the type of cancer that you have and what stage the cancer is. There are many different types of treatments, and you might not have to have all of them or any of them depending on how far along your cancer is and what type of cancer you have. To know what type of treatment you're going to have, you have to know what stage or type the cancer is in. The types of cancers are metastatic breast cancer, which is known as stage 4. That is one of the most common types of breast cancer. You have ductal seronoma in situ, which is a non-invasive cancer, so it's less damaging. You have the invasive ductal seronoma, the triple negative breast cancer, inflammatory breast cancer, and breast cancer during pregnancy. This is the most common types of breast cancer. This came from the National Breast Cancer Foundation. So depending on the type of cancer you have, depends on the type of treatment you will receive. The types of treatment can range from surgery to radiation to chemotherapy. Now, you will have to have surgery for all these types of cancer so they can actually remove the cancer. Some other treatments are medication and hormone therapy. An example of a kind of treatment you would have to have is, say you have stage 4 You would have to have chemo and probably also radiation and medication, but you will also have to have surgery. Chemo is one of the hardest treatments because when you have it, it makes you sick the really first couple of weeks, and then after the first couple of weeks, you aren't as sick, but you're still very weak from the actual treatment and your body trying to heal itself. And even with chemotherapy, you will lose your hair, which is one of the side effects of chemotherapy. You will most likely have to have surgery no matter what type of cancer you have, so they can actually remove it. The surgery will also decide what type of treatment you have to have. So I have talked about the ways to detect the symptoms, the treatments for breast cancer. So you should understand what women go through when they go through this, and so that way they have a support system. There are many different ways to detect breast cancer, like at home or even medically. When you have cancer, you will have visible and non-visible symptoms that you have to face for years even after you've had breast cancer. I have also talked about the different types of cancer that you have, which depends on the treatment that you will receive. The main point for this speech is how you could find out if you have breast cancer and then what happens after you have it. With early detection comes the chances of less risk of the symptoms and treatments you could be less damaging to you.